Good evening to all the participants of this webinar. I am Dr. Nandini Gokulchandran. I am the Deputy Director of Neurology Brain and Spine Institute, and I'm happy to be doing this webinar for all of you. This is going to be a dual language webinar, um, myself in English, and this is more for the Portuguese speaking uh, uh, participants. For them, Mr. Tapiva Chitio will be translating. Welcome, Tapiva, and thank you for joining us. Are you unmuted?
Thank you very much. Can you hear me?
We can hear you, but very, the volume is very low. You may have to increase the volume a little bit.
Okay, thank you very much for this. I am live and here with you guys to speak in Portuguese.
So, Tapiva would be translating in Portuguese. And so I would be starting. This webinar is on recent advances in treating incurable neurological disorders with focus on autism, cerebral palsy, intellectual disability, muscular dystrophy, Down syndrome, and other conditions. With newer treatments like stem cell therapy or cellular therapy and neurorehabilitation, and more advanced, further advanced integrative therapies.
Yes, agora hoje vamos ter uma apresentação em avanços recentes no tratamento do autismo, paralisia cerebral, distrofia muscular, lesão medular espinhal e outras doenças neurológicas incuráveis, e os benefícios das terapias células integrativas mais recentes e célula-troncos.
Okay. So this presentation is more for information purpose, for awareness purpose, and this is not a substitute for consultation for patients and families, and this is in collaboration with Stem Cell Africa.
E esta apresentação é para só fins informativos, não é um substituto como uma consulta médica, para quais os pacientes ou familiares que querem consultar têm que consultar os médicos locais. E agradecemos à empresa Stem Cell Africa por convidar e fazer esta apresentação.
So, why are we here? Why are the parents, the caretakers, or the therapists, or the doctors here for this webinar? Because we have either some children in our family or some adults with neurological disorder, or we have someone we know, or we have patients, or we have neighbors, or people in our vicinity who have neurological conditions, and they have found that they need more information. There is very little treatment, and that's why this webinar, to see what all possibilities exist right now.
E por que nós estamos aqui? Estamos aqui por causa de uma criança e outra que tem uma doença neurológica, que pode ser autismo ou alguma doença que estão à procura de tratamentos e melhorias na criança. É por isso que nós fizemos essa webinar, para nós tentar explicar o que nós estamos a fazer.
So, what is the current situation? For example, if we take a child who has some problem, or the parents notice that there is a problem, the child is alone, is aloof, and doesn't speak or doesn't socialize, then you will take the child to a doctor and various assessments will happen. The doctor will maybe advise a brain scan to understand, or do a clinical assessment and say the child has autism. And then many a times the scan comes normal, the MRI scan comes normal, and then you are told to do exercise rehabilitation, and child does undergo rehabilitation, does show some improvement, but somewhere there is a lack, and somewhere you want to do more because you feel there is something more required. So at that time, parents look for various options, new treatments, and that's why you are here, to understand more about newer treatments.
Ora, o que está a acontecer a situação atual é que a criança às vezes não fala, não percebe, não está na escola e depois disso nós não sabemos o que está a acontecer e depois levamos a criança para os médicos para avaliar a criança e os médicos fazem vários testes, tipo MRI, tipo avaliações médicas, avaliações terapêuticas, para tentar ver o que se passa. Depois eles explica sobre que a criança tem que fazer terapias, tem que fazer terapia de reabilitação, mas os resultados são poucos, não se vê muitos resultados, só vê poucos resultados. E agora os pais ficam sem saber o que tem que fazer, mas o que deixa os pais com muitas perguntas.
So, what are the current treatment options available? Number one, for various neurological conditions, there is no cure. Number two, there is no surgery for many of these problems, no surgery for autism, no surgery for intellectual disability or muscular dystrophy. There's only rehabilitation therapies and there are no medicines.
E esses tratamentos, essas condições atuais não têm cura, não tem intervenções cirúrgicas e só apenas reabilitação e não tem medicação para melhorar a situação.
So, when you see a scan, this is a PET scan of the brain, and till now it was thought that brain once is damaged cannot be repaired. This is the PET scan. All these blue areas that you are seeing are damaged areas. So till now it was thought that this is not correctable. However, we are here to understand that yes, this damage, it's possible to correct it.
Agora estamos a ver o slide de um scan que chama-se PET scan do cérebro, que mostra algumas lesões na parte do cérebro que normalmente dizem que não é curável, não se corrige, não tem tratamento. E nós estamos aqui para dizer sim, pode se curar, tem tratamento.
So how do you correct it? So it would be a combination of rehabilitation therapies with integrated therapies. So rehabilitation therapies would be occupational therapy, physiotherapy, speech therapy, applied behavioral analysis, aquatic therapy, and cellular therapy. And now new therapy is known as like ozone therapy and hyperbaric oxygen therapy.
E como é que nós fazemos o tratamento? Fazemos o tratamento de reabilitação e terapias entregadas, o que envolve terapia ocupacional, fisioterapia, terapia da fala, análise do comportamento aplicada, terapia sensorial integrada, terapia aquática e terapia baseada nas células troncos. E outros tratamentos novos que envolvem terapia do oxigênio, ozônio, terapia de cólon, crioterapia de corpo inteiro, sauna infravermelha e terapia de vitamina 6.
So all this together will help to improve the brain functioning and repair the damage.
E tudo isso vai ajudar para que o cérebro recuperar e tratar e curar o problema.
So let us see how the damage is repaired. So the top row shows us that these are brains which are damaged, which have a lot of damage. All these blue areas are damaged areas or low functioning areas. And with stem cell therapy and with rehabilitation and with integrative therapies, these blue areas will become more active. All these brains here in the second row is after stem cell, after 6 months, you can see are active. So these are activated brain. The first part is low functioning or damaged brain. The second part is after the treatment are the improved brain function.
Agora, essas mudanças são visíveis no scan. Se vais ver em cima, temos a parte azul, onde mostra que o cérebro não está a funcionar completamente, não está a funcionar 100%, funcionar adequadamente. Então, a primeira linha dos scans mostra onde a parte circulada mostra as partes afetadas do cérebro. E depois de fazer o tratamento de célula-tronco, vai mostrar que as partes já voltam a ficar azul e isso mostra que as células já estão a funcionar.
So let us take an example of a fractured bone. You can see a fractured bone here, and what will happen if your leg is fractured and you start doing exercise? Will you be able to walk? No. So you have to fix this bone. You have to fix the damage, and once the damage is fixed by using splint or by using plaster, then you can strengthen your muscle and then you can start walking. Same principle applies to the brain. So when there is a damage to the brain or when the brain is not strong, you need to first strengthen the brain from inside, and then when you do exercise and rehabilitation along with it, you find that you are more stronger, your brain is more stronger, and you see good improvement.
Isso é a mesma coisa com uma fratura no pé, nos ossos do pé. Quando tens uma fratura, não podes andar, não consegue fazer exercício. Primeiramente, tem que se tratar a fratura. Depois de tratar a fratura, é que podes andar, podes correr, podes fazer tudo. Isso é a mesma coisa no cérebro. Quando o cérebro está afetado, a criança não pode pensar bem, não pode fazer nada. Então, tem que se fazer o tratamento no cérebro, depois é que pode aprender a fazer alguma coisa, e a fala ou alguma coisa.
So earlier, as I said, the old thinking was that once the central nervous system is damaged, it is incapable of regeneration. However, the new thought process is that regeneration is possible with the help of cellular replacement or cell therapy, and repair and regeneration is possible.
Agora, o pensamento antigamente dizia que não se recupera o problema do cérebro, não se faz nada, não tem como, mas o novo pensamento é que tem alguma regeneração que é possível no meio do processo de substituição de células afetadas com células tronco.
So, what are the treatments currently available for when there is a brain or a spine damage? In general, for any disease, any condition, when you go to a doctor, you get either medicines or you get surgery, right? So, every treatment is either medicine, drugs, injection, or there is operation cut, okay? But now in the new modern medicine, there is a new treatment, that is cellular therapy, which is neither medicine nor a surgery. It is a procedure.
Agora, os tratamentos que havia disponível era do tratamento de medicações e tratamento cirúrgico. Agora, é só isso, mas agora já temos outro procedimento do tratamento que é terapia celular, que não é cirúrgico e não é medicação, mas é um processo que tem que ser feito. É um procedimento que tem que ser feito.
So, now introducing one of the most recent advances in medicine, that is stem cell therapy, whose time has come. It is not a fiction, it is not a futuristic science, it is for something which is happening right now and which has helped many children on the wheelchair or the children with brain affectation to improve and start walking and understanding and doing their own activities.
Agora vou apresentar o tratamento de célula-tronco, que é uma ideia cujo tempo já chegou, que não é só científica, mas é um tratamento que pode curar muitas doenças, crianças que estão na cadeira de roda, crianças que têm problema de processamento mental e tudo mais.
So what are stem cells? So basically stem cells are like stem of a tree which can give rise to branches, and if you give them proper growth factors and fertilizers, they can give rise to leaves, flowers and fruits. Similarly, these are special cells in our body which are capable of multiplying many times, 1,000 times, form new many cells like themselves, and depending on where you put them, they can become cells of that organ. So if you put them in the liver, they can become liver-like cells. If you put them in the heart, they can help repair the heart. We are using these cells to repair the brain and spine.
Agora, o que é células troncos? Células troncos é como troncos de uma árvore. E essa árvore já é que o tronco é que dá folhas, dá frutas e tudo mais. É a mesma coisa com células troncos, que eles podem transformar-se para fazer tudo células do corpo.
So what are the different type of stem cells? So there are different types of stem cells. They can be embryonic stem cells when they are taken from 3 to 4 days embryos, or they can be cord blood stem cells when the child and mother is connected with a cord when the child comes out. That also has stem cells. If we don't have these cells, then we have our own cells in our bone or in our teeth or in our fat. So these are different types of stem cells, and a new type of stem cell is a induced pluripotent stem cell, on which a lot of research is still happening.
Agora, os células troncos, temos várias células troncos. O que temos células embriônicas, onde são células que saem de embrio, e depois temos outras células adultas que saem do célula do osso. Depois temos célula tronco cordal umbilical, que sai de cordal umbilical depois de uma criança ser nascido. E depois temos outras células induzidas que chamam-se pluripotentes, que significa que essas células são células que podem fazer tudo, podem fazer qualquer músculo do corpo.
So what is the speciality of these cells? As I've already told you, they multiply and they can repair, they can replace, and they can regenerate. So if there is a damage, they can help to repair that part, they can help to replace the damaged cells and to regenerate that part into a better functioning area.
Agora, as células, a função de células troncos, eles podem reparar, podem substituir e podem também regenerar na forma do tratamento deles. Eles podem se transformar para fazer qualquer célula e para tratar qualquer doença.
So what is he saying? He was a Nobel laureate in physics who himself was suffering from a neurological condition. And what he said is that there are special cells in our body which have the power to repair our cells. And that's the cells that we are going to channelize, to use to repair the brain and spine.
Agora, o que ele está a dizer? Ele é cientista que ele estava a dizer que no nosso corpo tem células troncos que podem ser usadas para transformar, para nos curar qualquer doença que existe nos nossos corpos.
So let us look at how do these cells work. What is so special about them? How are they different from other normal cells?
Ok. Quais são as células, essas células? O que eles podem fazer? Como é que eles podem fazer?
So they have the capacity to multiply. So one cell can become hundreds and thousands of cells which are similar to the original.
Ok. Essas são células que podem começar uma célula e depois podem multiplicar para fazer muitas várias células.
The second specialty is they can convert into other type of cells. That means, like you have when children go into school, they don't know what they are going to become when they become older, but once they go into school, they learn, they get influenced by other people, they get inspired by others, and depending on that, they become engineers or doctors or teachers or therapists, or different possibilities. Similarly, these cells have the potential to take signals from their surrounding. If you put them in liver, they will take signal from the liver cells and they will go and repair the cells and become cells like the liver cells.
Então, essas células podem converter para fazer qualquer célula do corpo. E como as nossas crianças que crescem vão para a escola, mas outros depois transformam como médicos, outros transformam como cientistas, outros transformam como qualquer funcionário. E como essas células começam as mesmas, mas essas células podem se transformar para fazer qualquer célula do corpo.
So the third thing that they do is release positive chemicals. Okay, so they release a lot of good chemicals which will go and stimulate the repair process. So these are all different chemicals that they have the potential to release. So they are a very good influence on other cells in the nearby. So similarly, taking example of a school. So in a school, if you have in a classroom, maybe you'll have 10 very brilliant students, and you'll have 10 or 20 average students. So if you want to increase the capacity of the average student, you keep them with a very intelligent boy, so that the intelligent boy can teach, or they can stimulate the average student. Similarly, stem cells are like intelligent student. They will stimulate the cells which are functioning less or which are inactive by release of positive chemicals.
Ok. A outra função das células troncos é que eles podem produzir químicos positivos. Essas químicos positivas têm poder de estimular outras células que não estão a funcionar 100% no corpo. Isso significa que, vamos dizer que é uma criança que está na aula, que está na sala de aula, há outras crianças que não estão a perceber bem, que não estão a se entender bem, mas por causa de ter outras crianças, eles vão a ser motivados para fazer outras coisas, para pelo menos perceber o que o professor está a dizer. Então, isso é a mesma coisa com químicos que estão a ser produzidos com células troncos.
The fourth thing that they do is improve the blood supply. So as you know that blood supply is very important, as a blood supply brings more oxygen. The stem cells will improve the blood supply in the brain, for example, improving the oxygenation of the brain, which has healing power.
A outra função é melhorar a vascularidade sanguínea no cérebro, a dizer que sangue vai circular mais no cérebro e depois disso temos muita oxigênio e muitos suplementos nutricionais que estão a chegar no cérebro.
So we've talked about the major type of stem cells: embryonic, umbilical cord, adult, and induced pluripotent stem cells. But embryonic stem cells are not to be used because there is a possibility of tumor formation, and because they use embryos which are 3 to 4 days old. So ethically, there are issues. While we can use adult stem cells because they do not form tumors and there are no ethical issues surrounding these cells.
Agora, falamos de células troncos como embriônicas e essas células embriônicas não estão a ser usadas porque uma mulher tem que abortar para poder usar as células troncos. E falamos também de células troncos adultas, que são da mesma pessoa e são seguros, e são essas células que são recomendadas para usar.
So when we are generalizing stem cells, it is like saying that all stem cells are same. It is important to differentiate. For example, if you see this, one is an alcohol and one is orange juice made by mother with lot of love, and we can say that both are beverages and both can cause liver damage or can cause toxicity. However, we do know that alcohol has long-term problems and toxicity, while orange juice is nutritious. So when we put everything together, we are actually combining embryonic stem cells and adult stem cells and saying that all of them are dangerous. But embryonic stem cells are like alcohol, they have long-term problems, while adult stem cells from bone marrow are absolutely safe, like juice made by the mother.
Então, o que estamos a falar é a mesma coisa com bebidas. Temos bebidas alcoólicas e temos bebidas de sumo, como sumo. Então, nesse sentido, vais ver que as bebidas alcoólicas têm efeitos secundários ao longo da vida. Isso significa que é como se fossem células troncos embriônicas que têm efeitos secundários ao longo da vida e depois o sumo é como células troncos adultas que têm efeitos positivos na vida. Mas quando as pessoas estão a falar de células troncos, normalmente falam de como sumo generalizar os sumos, mas essas sumos são diferentes, essas bebidas são diferentes. Depende. Então, é a mesma coisa com as células troncos. Temos células troncos embriônicas que nós não usamos e tem efeitos secundários, enquanto nós usamos como sumo, que é puro e tem muitas vantagens e são células troncos adultas.
So, why do we choose to work with adult stem cells? Because they are safe, there are no rejection issues, easily obtainable, no ethical issues. So, we use cells from the patient's own body, that is from the bone marrow, and these are known as adult stem cells.
Agora, por que nós usamos essas células troncos adultas? É porque são seguras, não são tumorigênicos, não têm rejeição das células, são facilmente obtidos, porque através de uma injeção e não tem questões éticas.
So, what is regenerative medicine? Regenerative medicine is basically use of materials or cells like stem cells to replace the damaged cells or repair the damaged cells and make them healthy cells. So, like this is a brain, you can see the blue area is damaged. The stem cells will go and stimulate this area, repair this area, and convert the damaged cells into active cells and thereby improve the brain functioning.
Agora, o que é medicina regenerativa? Medicina regenerativa é uma nova modalidade terapêutica que se usa células troncos, células saudáveis, para substituir células danificadas. É como se fosse no scan que tem um cérebro afetado, depois injetado células troncos saudáveis, vai resultar num cérebro saudável.
So, first let us understand what is the scientific basis of stem cell therapy or regenerative medicine. How far back is the research going on, and what is the credibility of this new area of medicine?
Ok, então qual é a base científica de terapia com células troncos? Porque existe uma base científica que mostra a utilidade de células troncos.
So, the research or the work of stem cell research goes back way back, almost 50 to 60 years now. In 1990, the first Nobel Prize was awarded to the field of stem cells to Dr. Thomas, who demonstrated that there are stem cells in the bone marrow, okay, which we use. Then in 2007, another award was given to another scientist for the isolation of embryonic stem cells, and recently in 2012, another group or another pair of scientists, two different scientists, got the third award the third time for stem cell research. So in the history of Nobel Prize, which is one of the most topmost prizes in the world, 3 times in the history, stem cell research has been awarded a Nobel Prize.
Agora, temos prêmios Nobel em pesquisa de células troncos. Em 1990, o Dr. E. Tomás é que ganhou o prêmio de científica que ele pesquisava de demonstração de células troncos adultas que saem do osso. Depois, em 2000,
So that was about the world research. Now, at Neurogen, my institute, what is the scientific basis? Like, what
células
type
troncos.
of research has Neurogen done to understand how bone marrow stem cells work?
Agora, qual é a base científica que o Neurogene já fez até agora para a pesquisa de célula troncos?
So at Neurogen, all the work that is done is published in scientific articles, and we have about 101 scientific articles on various topics like autism, like cerebral palsy, muscular dystrophy, spinal cord injury, which tells about our experience and our expertise.
A Neurogena já tem publicado 111 artigos científicos nacional e internacional que fala sobre o uso de células troncos em autismo, paralisia cerebral, músculo distrofia, AVC e muitas doenças na área, o que mostra a credibilidade e a experiência na área de célula tronco.
So apart from scientific publications or scientific articles, we have also written chapters in books, chapters in textbooks for autism, for cerebral palsy, for other physical disabilities, where we are talked about pediatric neurological conditions, muscular dystrophy. So there are multiple book chapters which brings out the amount of experience that we have, that we are pioneers or experts in this field.
A Neurogena já tem publicado, tem artigos, capítulos nos livros da medicina que
So at the government level also, there is higher support for stem cells from our Prime Minister.
E agora o governo da Índia também reconhece o trabalho da Índia, como o primeiro-ministro da Índia também ajudou e também visitou a Neurogena.
He visited the Japanese scientist, Professor Yamanaka, who won the Nobel Prize recently, to understand how stem cells can be used to treat various disorders. And he brought that technology or the research to India as well.
E o professor Yamanaka de Japão também ele visitou e também trouxe o tratamento de células troncos para a Índia, para continuar com os tratamentos e melhoramento do tratamento.
This is our this Professor Dr. Alok Sharma, who is giving a book that we have written to our Prime Minister to share the knowledge that we have put together in a book.
Esse professor, o Dr. Alok Sharma, apresentar o livro que a Neurogena já escreveu para o primeiro-ministro da Índia.
So, understanding all about stem cells, I'm sure as parents and as caretakers and patients, you must be wondering, how is this treatment done? How difficult is it? Is it a big surgery? Will it be painful? So I'm going to give you a brief about how the treatment is done.
Agora vamos falar sobre como é que esse tratamento está a ser feito. Como é que se faz o tratamento?
So the treatment is in 3 simple steps. The first step is taking the bone marrow from the hip bone. Here you can see a very thin needle goes into the hip bone and thick blood-like fluid comes out of it. It is very thick like blood. That is just through one needle. The second part is the laboratory separation where the patient is not affected, and then injection into the spinal fluid in the back. So just one needle, you can see a very thin needle. So one thin needle in the hip bone, one thin needle in the back. That's only two injection, no cut, no stitches, no pain.
Agora, o tratamento está em três fases. A primeira fase é a retiração das células troncos, tirar as células troncos do corpo, onde vem, como depois a segunda é laboratório, onde vem a separação das células. Separar as células no laboratório, contagem das células que vão ser, e depois ser injetada intratecal na coluna.
So the process is very simple. You can see, you won't even see one mark once the bandages come off. So this is the bone marrow aspiration.
Agora,
Yeah, this is
o
the
tratamento é muito fácil, não se vê nada, só vem o marco onde a injeção foi injetada.
So these are the cells what we finally get from the bone marrow which is removed, and then injection after counting.
Essas são células que vão ser injetadas depois de ser contadas e vão ser injetadas na coluna.
So I talked about why do we use bone marrow cells? We take it from the patient's own body. So there is no rejection issues, and there are no long-term complications. And we inject it here in the back in the spinal fluid so that the cells will reach the brain. Okay, so why do we inject? Because it is not an operation. It is called minimally invasive. It is safe. There are no major side effects. The cells can go directly to the brain without getting diluted in the liver or lungs or in the spleen as when it is given intravenously.
Agora falamos por que nós usamos as células troncos adultas. É porque são usadas da mesma pessoa, as células da mesma pessoa, e as células troncos são o procedimento, não é invasivo, é seguro, não tem efeitos colaterais e também não tem lesão, e as células são injetadas na espinha, depois as células vão subir para o cérebro para curar o cérebro.
So let us look at how stem cell therapy helps various conditions. I'm sure there are parents who have children with autism who are very eager to know how stem cell helps autism.
Agora vamos falar sobre como é que o tratamento pode tratar as doenças como autismo.
So what is the why is it important to address this condition? Because the numbers are increasing. Statistically now, 1 in 58 children have been diagnosed to have autism. That almost 1% of the whole of world's population is diagnosed with autism now.
Agora, 1% da população mundial até agora é diagnosticada com autismo, o que significa 70 milhões de pessoas que estão nesse aspecto do autismo.
We know what autism is. Autism is a neurodevelopmental condition where the problem exists, though from the birth, you see it around 1.5, 2 years of age, and children have different problems. It is found more in males than in females.
Agora, nós sabemos o que é autismo. O autismo afeta a comunicação da criança, afeta a interação social, afeta a comunicação, afeta o comportamento da criança.
Basically, there are three main problems, but there are a lot of things below it. One is poor social interaction, impaired communication, and repetitive behavior, and sometimes even understanding and comprehension is affected. Hello? Tapiva, are you there? Hello, Tapiva, are you there? Okay. So I think Tapiva may have, huh? but I can't hear his voice. So, so there are different problems. The child is very hyperactive, doesn't, yeah, I think he's logged out. He may log in again. Okay, let me just, yeah. I think he is having network issues. No? Message her. Tapiva, are you there? Hello? So I'll continue till the Piva comes. So the child could be hyperactive, who not may not sit in one place. Learning gets affected. Socialization is not there. Communication is affected. The child may not be able to, speak, or even if they can speak, doesn't know how to express his needs. So let us first understand what is new in autism. What is new from what has been known till now? So, what is new is that our understanding of autism is now changed, and now we have a treatment, that is stem cell therapy for autism. So, how have we? How is the understanding changed? Because through brain scanning. Earlier, it was thought that autism is a psychiatric condition, and now we know that it is a neurodevelopmental condition. That means that as the child's brain is developing, the brain functions have not reached the appropriate status, and that's why the child is lagging somewhere or is different from other children. Number two, what have we understood? That earlier it was thought that autism is a one time problem, that it occurs and the child remains as he or she is throughout. But now we know that it is a developmental condition, and sometimes over a period of time, the individual may worsen and or the problem may alter and develop. So, develop both for positive and sometimes even for negative. So when we see brain scans or PET scans of different individuals, we find that the brain functioning has changed over time, sometimes for the worse. The third thing that we have found, earlier it was thought that the brain structure is absolutely fine, but we find that both the structure and the functioning is different, or the functioning is less, and that's what we have found through the PET scan, and which has been published. So, what is the fundamental problem in autism? Why does it occur? Is something which parents keep asking themselves. So, why is my child different? What is wrong? So, we will understand what could be the possible reasons for autism, and we will also try and understand what is happening in the brain. There could be genetic factors and there could be environmental factors. Environmental factors could be one, problem before birth or during birth. During the mother's health is not good, or the mother is stressed out, or if mother has diabetes or the age is more. It could be because of intestinal dysfunction, or there could be toxic metals in the body which has prevented the brain development, as well as a new theory that maybe telephones could be a problem. So, what could be the prenatal and antenatal causes? It could be that when the mother is carrying the child, there could be some infection. It could be that mother could be diabetic during pregnancy. I will just check if Tapiva has come back. Huh? Because, but yeah. Okay. Sorry. So, mother could be diabetic during pregnancy, or could be depressed, or could have be taking some medications, or could have PCOD, or there could be other stressors. Sorry. Age of the father, it has been found, there are research articles which say that if age of the father is higher, chances of the child developing a brain condition or a neurodevelopmental disorder, one of them being autism, could be higher, or almost 3 times higher. Children with autism also may have abnormal gut problems, due to which the bacteria in the gut is not digesting the food properly or nutrition, which and hence doesn't reach the brain. Electromagnetic radiation due to the phone when the child is in the womb, too much usage of phone could also lead to radiation issues. So that could lead to altered brain development, could lead to blood-brain barrier becoming higher, increased, and thereby leading to more toxic chemicals reaching the brain, altering the brain functioning. Lead poisoning, environmental factors, when the child is in the mother's womb or when is growing, too much lead toxicity could lead to mental functioning being subnormal. Mercury poisoning due to various heavy metals could lead to brain function issues. However, vaccine associated ESD, that theory has been refuted. Earlier, there was a paper which showed that vaccine could lead to autism. However, there have been 25 paper studies after that, scientific articles, which says that MMR is not a cause of autism. So, what goes wrong in the brain? Then let us understand. Okay, there are different causes, but what exactly happens in the brain? Here you can see a PET scan of the brain. Now, what is the difference between an MRI and a PET scan? The MRI shows structure of the brain, while PET scan shows functioning of the brain. And here you can see the blue areas here are damaged, and these areas are functioning less, which collaborate with the problem the child is having. Okay, so this has been published in the World Journal of Nuclear Medicine, where we have shown a comparison of how a brain of a normal child develops as compared to a child with autism. The blue indicates normal or typically developing children, while the orange indicates children with autism, where you can see that in a normal child, the brain development increases fast up till 10 years and then increases but slows down. However, in a child with autism, the brain functioning is becoming worse. So that's why it is important to do treatment early here when the problem is less. So if you treat before 5 years, we find the best results. So how has the treatment changed? A lot of new therapies got added as the understanding improved, and now we have all of these along with stem cell and hyperbaric and biomedical, and along with rehabilitation. We have so many different therapies. So all of this together work very well. So we have applied behavioral analysis, which helps to correct the behavior of a child. Then we have occupational therapy, which teaches the child how to do various activities like, brushing your teeth, or going to the bathroom, or having a bath, which is very important. Then we have sensory integration therapy, which teaches the child how to respond to external stimulus. So these are all various rehabilitation measures. This is a sensory integration room in our institute, which helps children with autism where they can be treated or trained. Speech and language therapy, again, very important. Physical therapy helps. Aquatic therapy, exercise in water. Art-based therapy. So along with that, this is hyperbaric oxygen therapy. I'll be talking a little bit at the end about this therapy. You have neurofeedback, where brain is stimulated using different waves. Removal of heavy metals from the body. This is a microbiota transfer therapy. Not much evidence is available. Nutritional supplements can help to improve brain functioning. Diet, very important to reduce sugars. Do not give sugar. Do not try to give natural foods. Do not give additives or pesticide containing or stored food as much as possible. So these are all various therapies, but even with all of these, are we doing enough? Are we addressing? We are not addressing the problem in the brain. We are not addressing the actual damage in the brain. And that's why we need to do something from inside. And that's where stem cell therapy comes. So let's look at the results of stem cell therapy in autism. What are we finding here? Here we find that 90% of the children that we are treating show some result or the other. There is 10% who may not show improvement. If you look at the percentages of improvement, we see that there's improvement in hyperactivity, there's improvement in attention, concentration, eye contact, social behavior, emotional responsiveness. This is the first ever uh, publication or first ever evidence which was published in a scientific way by Neurology, or first in the world, which shows that autism is helped with stem cell therapy. This is the second article that Neurogen has published of recently, which has a data of 254 individuals, and scientifically we have seen that out of 254 they were at the age between 2 to 34 with a minimum follow-up of 7.5 months. So what do we see? We see improvements in various symptoms, improvement in command following, improvement in hyperactivity, in self-injurious behavior becoming lesser, attention, concentration improving, communication improving, speech improving. Okay. So what we find that clinical scores or functional scores also show improvement, and based on the, so we can see that there's improvement or in the earlier age in both males and females. We see we can see improvement in mild as well as moderate uh, patients. We see that if we treat the children earlier, before 5 years, we find almost 98% success rate. Between 5 to 10 years, about 94%. Between 10 to 15 years, 90 to 94%. Above 15, 91%. Males and females both show good improvement. And analysis, if you look at how early the child comes after diagnosis, if the child comes early, the result is better. When we do a comparison of PET scan, we find that there is a improvement in the brain functioning. If you see this scan here, you can see that the blue areas here indicate damaged brain or problem in the brain. This is after the treatment. Before the treatment, you can see a lot of damaged area. Darker the blue, more the problem. And we see improvement after 6 months. Here the functioning brain is increased. The dark blue has become light blue and green. Again, so there has been a power cut at Tapiwa's side, so we apologize for the same, unfortunate, but I hope you are able to follow with the translation on the slides. So you can see the blue areas here is damaged. Before the treatment you can see, and after the treatment you can see that the blue has become green. So the brain is getting activated. These are various examples of autistic brain in different parts of the damaged areas. This is brain functioning followed up over 2 years, 1.5 year. So the blue areas here before the treatment, 6 months later, and again 6 months later, you can see that the blue areas are reducing and green is improving over a period of a year and a half. So these are publications which have been published on autism from Neurogen and from the world. And we find that it can be done in combination with other treatments as well. Some examples and videos of improvements seen in children with autism. This is a story of a 10-year-old boy from US.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that. He would walk on his tiptoes, look at the wall, and be talking to the wall. He had problems with eye contact. He never looked you straight in the eye. He had problems with his speech. So research and found out about neurology. But the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer. I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his food is so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. It's all the PET scan images. I can't tell you the word, we were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the third grade, fourth month reading level to a seventh grade first month reading level in 5 months.
This child who was autistic improved so much that his speech is clear, behavior has reduced, he shifted from special school to normal school. His grades have become A plus, and he's learned English, Spanish. So even in language and communication, he has improved. This is example of another child from Kenya, who was locked in home for almost 13 years, extremely hyperactive. I wish Tapiwa was here because he has treated this patient, and I was hoping that he will talk about this himself, because he has seen this child to be extremely violent, extremely aggressive, and after stem cell, he's calmed down, his understanding has improved, he has become more social, he's able to do various activities. At least now he's able to go to a special school where earlier he was not able to. He can now cycle and he can do swimming, and all of this was not possible earlier. So this is a child who has really changed completely after the stem cell treatment. This is another child from South Africa who came at a younger age and who has improved well.